Hi, Terry Buisman, physical therapist and co-owner of Ortho Rehab Specialists in Minneapolis and Edina. Today we're going to talk about a commonplace mechanical pain in the lower lumbar spine, the lower part of the back where it attaches to the pelvis. Very frequent in populations from 50 years and on due to early mechanical wear and tear. We're going to discuss the origins of this, why it comes about from an anatomical perspective, as well as what classically goes awry day to day, the origins thereof, and then talk about how we can alleviate a lot of this mechanical pain via improved functional mobility, as well as appropriate changes with posturing and mechanics. Symptoms with this scenario classically arise along the belt line, not a scenario where there's referred or neurologic-based symptoms going into the leg. So we're all classically aware of good posture, but what commonly happens is we collapse per se, whether it's standing around the center island in the kitchen, enjoying a conversation with friends at a holiday party, or with lifting a load where sooner or later there's muscular fatigue and we rely on loading bony structure in the bottom of the spine to allow us to continue on with the project. Either the microtrauma, prolonged use, or improper lifting and loading can create focal symptoms that can be enduring. If you look at joint structure through the lower lumbar spine, here's the lumbar spine here, attaching to the tailbone and pelvis. The orientation of the joints here are more in this direction. Thus, you can see that if we tip posteriorly, you can load them as such. The surface of the joint approximates to a degree, and it will serve as a great class 1 lever, bone against bone, but again, over time, you will pay a price. One can appreciate as well that forward bending will gap open these joints, and most people with this condition feel relief if they're bending forward, i.e. bringing knees to chest, or as well by placing a foot up onto a box or something of that nature. They'll gap open joint structure and they will feel relief. Nerves that innervate or tell us what's going on in this general region, innervate or go to the gluteal, along the tailbone, etc. So people initiating focal pain symptoms there often experience referred pain into the proximal buttock and tailbone. So again, the most common scenario for this onset of mechanical pain along the belt line is prolonged standing, whether you're at a kid's soccer game or again standing around the kitchen chatting with friends, and before you know it, you start to get sore through your lower lumbar spine. Again, the origins would be too much of a concavity or inward curve through the lower back. So a very simple way to go about this, as far as changing things is concerned, to alleviate a lot of this pressure, is to do the following. I'm going to have Chris internally rotate his toes just a little bit, and I want him to create a force laterally outward with both feet as though he's just trying to slide his feet along the carpet a little bit. He's actually not going to move his feet, but in doing so, he'll feel more tone through his glutes, and this is going to rotate his pelvis back. He's going to flatten it just a little bit. As well, now I want you to drive your sternum forward a bit, and I want you to have your thumbs forward, and that will pull you back into more of a neutral position as such. So he's changing foot position just a little bit, won't be noticeable by people around you. It initially engages the glutes a little bit more. You'll feel more tone through the pelvis, driving sternum forward to put the lower lumbar spine in a position where there is less impact bone to bone. Another simple way to modify this position is via stepping up on a footstool. It subsequently rolls the pelvis back, and that makes all of that easier as well. Very passive scenario, but works great at lunch counter, sink, etc., where you can, again, effectively diminish functional loading in the lumbar spine via elevating a foot. Either foot will work. From a flexibility standpoint, a couple easy stretches that can be implemented on a daily basis are as follows. Again, we want to gap joint structure here, so we want to move into flexion, keeping the spine relatively straight I'm going to have Chris just drop back as such, let the head go down, and again you gap there. A real nice pattern. We can make it slightly more challenging after, or for instance now I want people to hold this about 20 to 30 seconds per se. Let's go back up to neutral. Chris, bring your left hand right there and trap it with your right hand. Yep, I want you to fall back. We can address the left side a little bit more aggressively and put a nice stretch through the latissimus, the lat muscles on the left side. We'll gap open there a little bit more. Let's switch the hands around. Right hand over there, trap by the left, and fall back as such. Again, a nice way just to gap the facet. Go ahead and let your head drop down to get even more of a tug through the spine. Now let's tip you flat on your back. And simply bringing knees to chest. Again, a real simple way to just gap open the facets or those lower lumbar segments. So a place of relief. Now, Chris, I want you to roll onto your right side. Let's say there are more left-sided symptoms. Again, we've got Chris in a flex position. It's unloading these segments. As well, if symptoms are more acute, by rotating in a relative sense his torso to the right off the edge of the bed, here would be a comfortable position at night for someone who's having more left-sided mechanical base pain. So by initiating flexion here, we gap open. By creating rotation in relative sense to Chris's right, we gap that joint open more. So this would be a nice place to end up sleeping at night, maybe a pillow between the knees, etc. Again, just to separate these joints and give them a little bit of a break. Chris just completed a prayer stretch, and a prayer stretch with side bending. As symptoms continue to stabilize, we can take that to a slightly more aggressive pattern. First, I'll have you just elevate. We define that as an angry cat. We're gapping structure open in the back. You'll find this relieving. Now just slowly let it drop. And now we're closing the facets. There's not a lot of body weight creating compression here on the lumbar spine, so it's easy to tolerate, and the patient or the person is always in control with regard to the magnitude of how far they want to move. Let's go back up again, gap the facets. That's a comfortable place to be. Now just let it drop down and close them down until you feel just a mild stretch. As the days go by and you feel better, continue to accentuate the extremes of the motion. As symptoms continue to stabilize, we can get a bit more aggressive as far as moving or stretching soft tissues via a gentle stretch like this, which one can do over the edge of their bed. Go ahead and just tip forward as such. Again, if there are more left-sided symptoms, Chris is now gapping this joint open a little bit more, as well as putting a greater tug on involved soft tissues which are classically sore around the region. A slight modification of the last stretch would be done in a seated pattern. You can do this seated at work per se. Again, gapping open those last lumbar segments, giving yourself a bit of a break, and then tipping forward as such, letting the head drop. So a nice stretch. Obviously the other leg can be crossed to address here the left side. An important point here with respect to the mechanical lower back pain we're discussing today, when a person is seated, you double to triple the mechanical load on the lumbar spine. So those symptoms in conjunction with prolonged sitting is not advised. Thus, the progression these days to, say, a standing desk for part of the day, using a footstool to elevate one foot to again rotate the pelvis back, thus alleviating some pressure on the lumbar spine. So combinations of standing and sitting at work are your best. Sitting for a prolonged period of time, again, greatly enhances the mechanical loading of the lumbar spine. 95% of adults or greater will have some type of mechanical lower back pain in their lifetime. The vast majority of time it's treatable in a conservative fashion. This video has discussed origins thereof and ways to address it, to alleviate focal symptoms by simply initiating these simple stretches on a daily basis and modifying how you're standing for prolonged periods, pushing, pulling, lifting, etc. And you can look at other videos that we've created here to address that. For most of us, we can alleviate the vast majority of our lower back pain in a conservative fashion.